Hey guys, welcome to my channel. My name is Alina and this is Silicon Valley Live. We have breaking news about the novel coronavirus. A month ago, the World Health Organization declared an emergency of international proportions. And just a few days ago, on March 11, 2020, in connection with the lightning spread of COVID-19, the WHO announced that the spread of the novel coronavirus has become a worldwide pandemic. For your information, the World Health Organization hasn't declared a pandemic since the H1N1 influenza or swine flu outbreak in 2009. Let's find out how things are going with coronavirus around the world and in the United States, and in particular in California, Washington State and New York, which at the time of shooting this video are the states with the largest number of infected patients and deaths in the United States. So, if you want to know what the situation is with the novel coronavirus in America right now, and if you also want to learn how to protect yourself from the Chinese pneumonia, just keep on watching. The outbreak of the coronavirus infection, also known as 2019 nCoV or COVID-19, was first recorded in December 2019 in China. Thank God the Chinese authorities were quick to release information about the spread of the new pneumonia virus when it became clear that the infection was growing out of control. The original carriers of the new COVID-19 were animals. However, in rare cases, the virus can spread from animals to humans and is now swiftly spreading from person to person. The first infection occurred in a seafood market in the capital of Hubei province, the city of Wuhan, which usually sells wild animals which Chinese people eat. The most plausible story of the first human infection is that the infection occurred after a person ate a snake, which previously ate a bat infected with the novel coronavirus. After that, the infected person infected their relatives and they spread the virus to their immediate environment, and so on down the line. What is important to know is that if you had any contact with an infected person, you can easily become infected and show no symptoms for a period of 7 to 28 days. In this way, you become an unwitting host of the novel coronavirus and a peddler of the Chinese pneumonia simultaneously. When you are infected after the incubation period, the usual symptoms of a cold appear. Such symptoms could be dry cough, sore throat, runny nose, sneezing, fever, eye irritation, weakness, nausea, headache or shortness of breath, and even diarrhea. If left untreated, coronavirus develops into a complicated form of pneumonia and may even result in death. There are no symptoms that are unique to Chinese pneumonia. It is only possible to distinguish the novel coronavirus from SARS or ordinary flu by laboratory test. In just 10 days, Chinese biologists deciphered the genome of the new strain of the Wuhan pneumonia virus, and scientists from around the world are already working on a vaccine. However, the problem is that the virus can mutate and change its genome, creating a new, more survivable strain. It can take at least 10 months to create an effective vaccine, and even then the vaccine is still in its initial phase without clinical trials. During this time, the number of deaths can exceed tens of thousands. Those most vulnerable to the virus include the elderly, as well as people with a weakened immunity. So if you treat unrelated symptoms with antibiotics which have a risk of weakening the immune system, you should be careful about the novel coronavirus. Surprisingly, the number of infected among children is incredibly small. A map has been created on the internet which shows the estimated speed at which the virus is spreading. In reality, the killer virus spreads much faster. Back in distant 1993, 27 years ago, the writers of the famous animated series The Simpsons predicted the Asian coronavirus, an upcoming global epidemic. In Season 4, Episode 21, two Asians packaged a parcel of the goods at the juicer factory in China for shipment to Homer Simpson in Springfield. Before packing, one of the workers accidentally sneezes into a box and the package with the virus is sent to the United States. While workers at the Chinese factory make light of the fact that one of them is infected, Homer receives this package from China which contains the infection. After that, a significant part of the world's population is infected with this unknown deadly virus, which arrived in this box. People demand a cure to get rid of the epidemic, but there is no medicine for them. What happens next is a series of events which are less cheerful and more worrisome than most episodes of The Simpsons. According to Wikipedia, at this moment, coronavirus has infected over 168,000 people around the globe, and the number of worldwide deaths from this terrible disease is already more than 6,500 people. At the same time, Donald Trump announced travel from Europe will be suspended for 30 days to prevent the spread of coronavirus. These measures have been in effect since March 13, 2020.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight.
The Chinese virus has reached all possible continents on planet Earth, such as Europe, Asia, Australia, Africa, and North and South America. There are almost no countries in the world where the coronavirus has not been reported. More than 156 countries report cases of infection, and the World Health Organization predicts an even greater rise in the number of infections and deaths from coronavirus, because portions of the population may be infected but are not able to be tested for COVID-19 at this time.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
I will not be surprised if the novel coronavirus appears in the North Pole and somewhere in Antarctica, because people are traveling like crazy these days. This is not funny at all. This is what a real apocalypse looks like. At the time of shooting this video, over 3,300 cases of coronavirus are reported in the United States, most of which are found in such states as California, where we live now, Washington State, and New York. 62 cases of deaths from Chinese pneumonia have been reported in the United States. In the Silicon Valley, where we now live, the first case was reported on January 31st. After the local media distributed information about it on the internet, all of the masks in shops and pharmacies instantly disappeared. I've heard that people have even bought as much as a 3-year supply of medical masks.
Since we are a large county and many of our residents travel frequently for business and personal reasons, we're not surprised to be announcing the first case in the Bay Area and in Northern California.
The first cases reported in Silicon Valley were in Santa Clara, which is just 5 minutes away from my house. I have to go out almost every day in Santa Clara, so like everybody else, I also ran out to buy masks. I traveled to 8 local pharmacies around the Bay Area, and there were no masks. They simply were sold out or out of stock, of course.
Сейчас находимся в Таргете, в Силиконовой долине. Сегодня, когда объявили первый случай коронавируса, маски все раскупили. Вот, пожалуйста, out of stock. Sold out во всех магазинах. И вот здесь тоже. Так что так, друзья.
In short, the masks were sold out in the first 2 hours after the news about the appearance of the virus in Silicon Valley. In other countries where masks are available, reported cases of the virus caused mask prices to rise as much as 650%. Just think about that, 650%! There is a worldwide epidemic, and rather than help the population, pharmaceutical companies choose to profit from the incident. This is just awful and terrible. Masks are not available even on Amazon. If they are available, then they are sold at inflated prices or with delivery after 2 months. Owners of businesses which produce masks profit as much as they can. However, masks will only help those who are already infected to not spread the infection further. For healthy citizens, one can be infected if the virus comes into contact with the eyes, which masks unfortunately do not cover. This is a risk since the deadly coronavirus is transmitted by airborne droplets. So a mask can certainly reduce the risk of infection, but it will not protect you from the Chinese virus by 100%. So how do you protect yourself from coronavirus? First, avoid contact with people who have any symptoms of respiratory illness, coughing, sneezing, fever, etc. Second, when you are outside your home, try not to touch your face with your hands, especially such vulnerable parts as your eyes, nose and mouth. Third, wash your hands regularly with warm water and soap for at least 20 seconds. Be sure to wash your hands after leaving and returning to your home. First rule: if there is no opportunity to wash your hands, use an antiseptic gel or alcohol-based liquid. And the last rule to follow: wear a face mask. Yeah, but as I said above, the mask will not protect you 100%, and in order to minimize the risk of infection with the killer virus, be sure to close all the gaps between the mask and the face around the mouth and nose. Also, a clean gauze mask should be worn for no more than 2 hours, and then it must be disposed of correctly and safely. Otherwise, there is no point in wearing it. That's all for this video, but there are many more videos coming up. If the information from this video was useful to you, please make sure to like this video and subscribe to my channel Silicon Valley Life so you don't miss any new videos. If you have any questions regarding the United States or the novel coronavirus in the US, please leave a comment below and I'll be sure to answer. I'm Alina and this is Silicon Valley Life. Please stay safe from the coronavirus. See you later, alligator. Bye.